Okay, that's what has been said is significant, and that leads us to our talking point. Will vaccines work against Omicron? The jury is out on that. Is Omicron even more contagious than Delta? Jury out on that. Will flight bans stop Omicron from spreading? Jury out on that. What then is the best way to fight the Omicron threat? Let's widen this debate. Joining me now, Dr. V. Ravi. He is a virologist who's been part of the genome sequencing team in Karnataka. Dr. K. Srinath Reddy, President, Public Health Foundation of India. Professor Lawrence Young, virologist at Warwick University. And Dr. Shankara Chetty, medical practitioner, is joining me. I appreciate all of you joining me at the moment. I know you've got to leave us a little early, Dr. Srinath Reddy. But very interestingly, you had an article today in the newspapers which suggested, don't alarm the world, be alert, but don't be alarmist. Is that what you're sticking to? Do you believe that there's been an excessive reaction to the new COVID variant, particularly from WHO, declaring it almost immediately as a variant of concern that has spooked the world?
Caution is warranted, but panic is not. Basically, there is likely to be a faster spread if we give it an opportunity by being careless, not wearing masks, by crowding, and not following the COVID-appropriate behavior. It is likely to spread across the world if we allow it to. But we also have to recognize that there is a greater level of protection now for most people from severe infection and death, either because of previous exposure to natural infection or because of vaccination at various levels. Secondly, whatever information we are getting from South Africa at this moment, though it's based on small numbers, is that the clinical manifestations are relatively mild and not as threatening as that of Delta. We know that the mutations that it has, in terms of the spike protein mutations, are likely to make it more infectious, also possibly more resistance to the effect of immune response created by those vaccines which are principally focused on the spike protein.
Right.
Which are most of the mRNA vaccines and some of the virus vector vaccines. But who have already had a natural infection or who have had an inactivated virus vaccine would have been exposed already to multiple antigens of the virus, and therefore the assumption is that they are likely to resist a variant better than people who have only been vaccinated with a spike protein vaccine. We do not know. However, the spike protein is essentially used by the virus to penetrate into the cell, and antibodies are fighting it actually in the bloodstream. Whether the virus is going to be more lethal or more virulent in terms of the clinical manifestations is not dependent on the number of mutations it has. There are other factors that determine.
But are you clear, Dr. Reddy, that if someone is double vaccinated at the moment with Covishield or Covaxin, there is less likelihood again of the person being severely affected by Omicron, or is it too early to say that?
It is too early to say that. We'll have to look at the laboratory studies as well as the clinical data on breakthrough infections. But the theoretical premise is that those who have been exposed to the multiple antigens of the virus, either through an inactivated virus vaccine or preferably through a previous natural infection, are more likely to have a broadband immunity rather than only against the spike protein. But nevertheless, all of these assumptions have to be tested now, both in the laboratory as well as in the breakthrough infections that will have to be documented and investigated.
You know, it comes down, therefore, to has the world overreacted? Have we been alarmist? Let me take that to you, Dr. Shankar Chetty, because you're there in South Africa, and you've joined us in the past also in the belief that at times the world has been alarmist. Do you believe that the world is being alarmist in the manner that we are reacting at the moment to Omicron? Or do you believe because of the number of mutations, there is a fear that what is happening in South Africa today could happen across the world tomorrow?
I think that the mutation, the Omicron variant, is prevalent throughout the world, just not identified. Variants are common throughout the population, but those that tend to be the most contagious tend to spread. And that keeps changing over the evolution of this pandemic. So generally, in the natural evolution of a pandemic, the new variants become more contagious but less infectious. They tend to create milder infections. The aim of the virus is to spread, and so contagiousness tends to increase. And that's what we've seen in South Africa. The initial South African variant was far more contagious and far more deadly than the initial variant. The Delta variant less so. And now with Omicron, even less so. So more contagious and a milder variant. So I think the panic around the globe is unwarranted. Variants are out there. And until we identify the severity of illness that they cause, there's no reason for us to be panicking. It's important to mention that those that have natural immunity and those that have taken the live attenuated vaccines have a broader diversity of immune response, and so will likely have a better ability to fight this new variant. However, though, the mRNA vaccines and the adenovector vaccines are directed directly at spike protein. And so this change in the spike protein will make us more prone, those patients that have been vaccinated with those, more likely to be prone to having a breakthrough infection. But that has been seen with the Delta variant as well. The spike protein being used is the wild type, and the Delta variant showed a lot of breakthrough. So I expect that with this, we got to look at that percentage of the population closely. But of course, there's no reason to be panicking. The mildness of the illness is a good sign.
Right.
Children are affected. They were affected by Delta as well. Children have never shown severe illness. So it's a great thing that we have a mild variant that is also showing mild illness in adults. So I think there's really nothing to be fearful of.
That's reassuring again that you're saying there's nothing to panic. But Professor Lawrence Young, virologist at Warwick University, that's precisely what the world is doing at the moment. The world is closing its doors to Southern Africa. And as Dr. Coetzee warned us that, look, today by banning Africa, you're not going to resolve the problem till Africa is vaccinated. Why is the world, Professor Young, panicking in your view at the moment?
I think we're just all hypersensitized to these so-called variants. I call them scariants. We've had these scariants for all the way through the pandemic. And look at Beta, for instance, the Beta variant in South Africa. Again, lots of concern about that. But when push came to shove, that was outcompeted by Delta, and vaccines are protective, even though some of their efficacy is reduced. I think a lot of this is just is being hypersensitive. We know that variants are being generated all the time, and once the variant is identified, particularly one that is likely to be more infectious, it would have spread far beyond the few original cases and the original countries. So that's what happens. That's the nature of infectious disease, particularly in a small world where international travel is so common. I think what this does highlight, however, is something that your previous speakers have mentioned, which is that this is a global pandemic. Every country and every government in every country clearly prioritize looking after its own people, but actually this pandemic isn't going to be over until we protect everybody. It's a global pandemic, and we need to make sure that as many people around the world are vaccinated. That will stop the spread of the virus, and it will stop new variants from being generated.
That's interesting the way you put it. I love the word scariant, not a variant at the moment. Dr. B. Ravi, we saw this in Bengaluru. Just, when first the panic set in, 2 people isolated, it was immediately presumed because they'd come from Southern Africa, it must be Omicron. It now apparently is that in at least one case, it is possibly Delta variant. Do we need a full genome sequencing before we start predicting what this new variant could or could not do?
Absolutely, Rajdeep. The only confirmatory evidence comes from full genome sequencing. And in situations like this, there is rumor mongering. I got 100 calls asking me from various sources that it is confirmed, it is not confirmed, this patient is serious, is admitted. I think we have done so much great work. We've dissected the virus. We can tell you 31 mutations in spike protein, 10 in the receptor binding domain. The pathetic state is that we do not know about human behavior. I think it's time to tell everybody, as Dr. Srinath Reddy and Dr. Coetzee put it, no panic. Caution, certainly yes. And I think WHO did the right thing in saying If you look at the genetic code of this variant, it has acquired mutations from alpha, from beta, and from delta. For the first time, we have a variant that is challenging, at least on paper, is challenging delta. So that makes it, put it on a separate pedestal compared to other so many kappas and lambdas and so many things.
But Dr. Ravi, I just want to stop you for a moment, because if you recall, before the second wave, there was a sense that the genome sequencing had not been effective enough in India in time for India to prepare for what Delta did post-March 2021, earlier this year. Are we better placed today, 9 months later, than we were at the start of the year? Because if you recall, January, February, there was almost this exuberance. The then health minister, even the prime minister were talking almost as if we had licked the virus. Are we once bitten, twice shy? And are we better prepared now with our genome sequencing as well?
Well, I will just put the facts in front of you. The global warning for alpha came on December 22nd. India detected alpha variant on December 27th. India was the first country to report delta. Okay, I am not saying we should pat our back and beat drums and say we are capable of doing it. Okay. The essence is you have to have a clear strategy on what samples you sequence. Genomic sequencing is not PCR. There are several conditions to do it, and it's also time consuming. Whatever speed people claim on paper, it cannot be done less than 3 days. I have worked with my hands on genomic sequencing. Let me tell you that all the tall claims that I'll do it in few hours, in 10 hours, in 12 hours, no, it doesn't work that way. From the time the sample reaches, it takes 3 days to get genomic sequencing results.
So what's the earliest we will know about the real virulence of Omicron in this country, Dr. Ravi?
You mean whether Omicron is there in this country or not?
Whether Omicron is there in this country and how virulent it is.
Middle of the week, we should know whether Omicron is there in this country or not. As regards virulence, I'll go back to what Dr. Kadzia said and what the others have said, that you need a large data set to comment on virulence. A single swallow does not herald summer. That's saying you know very well. This is emerging data. We have to be patient. We have to be cautious. I always say this, and I will repeat it at the cost of being boring. We are responsible. Each individual is responsible for his or her protection. No country disseminates virus. No individual deliberately transmits virus.
Okay. Dr. Chetty, are you saying, therefore, that what would you say about traditional COVID protocols? What we've been told, masking, social distancing, of course, double vaccinating. Do you believe that stays the same, irrespective of what happens, how virulent Omicron turns out to be? We need to be careful about being in these large gatherings out there, because India has opened up, as presumably so has South Africa and large parts of the world. And Europe has paid a price for it in the last month.
I think that, yes, we got to follow the social distancing measures. Lockdowns haven't really proven to be that effective. Large gatherings need to be avoided. That will prevent the rapid spread of a virus, whichever variant it might be. But then we also got to consider that we are attempting to get to herd immunity. The vaccines haven't shown to provide sterilizing immunity. We're talking about the mRNA and the adenovector vaccines that are specific to spike protein. The inactivated vaccines have a better, broader diversity of antibodies. And so that might help us get us to herd immunity. But infections and natural immunity is what's going to get us there. So I think it's vitally important that we understand that a pandemic's natural trend is for the virus to become more contagious, but however, give us far milder illness. And if that turns out to be the case, then we should be watching the trend in infections rather than the trend in cases. Cases will be far more, but that will monger fear. because the infections will be far less and the severity of those infections far less. And even if the severity is far less, those people that get the infection and get over it will develop natural immunity.
So are you
that's the
are you supporting Dr. Chetty these travel bans that are being put in place? Do you believe that's wise?
Look, the travel bans, I don't think that they're wise. Yes, we need to be cautious about who's allowed to travel around the world, but ostracizing a country simply because of a new variant when we have absolutely no idea as to the infectiousness of that variant and the severity of illness it might cause is really nonsensical. You might be sitting in your country with a variant that causes far more severe illness. And a variant like the Omicron, if it provides milder infection, might outcompete that variant and actually bring benefit in the type of circulating variant that you have in your country. So we've got to be cautious about just trying to avoid variants simply because they're new. The general trend would be towards milder illness, and milder illness would outperform the previous variant that might have caused more severe illness.
Right.
So we can't control everything. Not with vaccinations, not with travel bans, not with isolation, not with any mandates. So I think we got to let the science shine through and do it very cautiously. Be aware of what's happening around us and be cautious in how we take this forward. The damage to society from our public health measures might be greater than the mild infection a variant can cause. So we got to be very cautious.
Very interestingly put, that, in a way, you've got to allow science to run its natural course. Dr. Ravi, in conclusion, if you look at India over the last few months, we've seen across the country, by and large, possibly with the exception of Kerala, that there has been a gradual tapering down of the virus's spread. And sero surveys suggest that in many cities of the country, in particular, more than 75-80% could in some way of the people could have developed antibodies. In that sense, can we be a little bit more assured that we will be able to tackle Omicron, however virulent it turns out to be, much better than we did with Delta at the start of the year?
Absolutely, yes. We can be reassured, but certainly not complacent. Please recall January, February of last year. We thumped our chests, we beat drums and said, we have conquered COVID. Nobody conquers COVID unless a large part, 90% of the globe has been immunized.
Right.
That's when we can relax and say, okay, we can slowly get back to normal. Until then, no.
Okay. I think that this has been extremely illuminating, and I think the discussion with top doctors from India and across the world has given us today perhaps a greater sense of reassurance than the kind of panicky statements that we've got from those in power at times, both in state governments and at the center. Let's be alert, but for God's sake, let's also not be alarmist in the times in which we live. I appreciate all my guests joining me here on the news today this evening.